Urology is a surgical specialty which deals with diseases of the male and female urinary tract and the male reproductive organs. The prostate is an important part of a man's urogenital system, and proper functioning of the prostate is important for proper bladder control and normal sexual function. Aside from skin cancer, prostate cancer is the most common cancer affecting men in the United States today, and it is the second leading cause of cancer death in men, only behind lung cancer. To learn more, we'll go to the Colorado Center for Robotic Surgery at Sky Ridge and talk with Dr. Edward, or Ted, Eigner.
Prostate cancer is diagnosed in 1 out of 6 American men today. Risk factors include age, race, ethnicity, and a high-fat diet. Prostate cancer can be diagnosed through a screening effort which includes both digital rectal exam and a PSA blood test. Now, PSA has been somewhat controversial recently, but it turns out that the data really supports that PSA screening decreases death rate. Since widespread PSA screening was introduced in 1992, mortality due to prostate cancer has dropped dramatically.
The Sky Ridge team uses the most advanced and least invasive therapies depending on your specific cancer and medical history. The more you know about your medical condition, the more likely you are to make informed decisions and choices about your care. One option might be a minimally invasive robotic prostatectomy. A prostatectomy is the surgical removal of all or part of the prostate gland. At the Colorado Center for Robotic Surgery at Sky Ridge, Dr. Eigner and his team are proud to perform more minimally invasive robotic prostatectomies than any other hospital in the Denver metro area.
Robotic-assisted surgery has rapidly become the most popular way of removing a malignant prostate. The prostate is deep within the pelvis in a very difficult to access area. That's why the capabilities of the Da Vinci robot, including both 3-dimensional vision and 10 times magnification, have been essential to delivering the results that all men want. And that includes improvement in both the continence and potency rates.
The Colorado Center for Robotic Surgery at Sky Ridge is committed to providing diagnosis and treatment of disorders of the female reproductive organs as well. When the muscles and ligaments supporting a woman's pelvic organs weaken, the pelvic organs can slip out of place or prolapse. Pelvic prolapse is common, affecting about 1 in every 3 women who have had a child. Prolapse risk factors include multiple vaginal deliveries, age, obesity, hysterectomy, and smoking.
Uterine prolapse is where the uterus, bladder, and vagina fall into the opening of the vagina. Many women may have symptoms, many do not. Some of the symptoms a woman might have is she may see or feel a bulge in her vagina. Commonly, they also experience urinary frequency, urinary urgency, urinary tract infections, and additionally may have constipation. Some women may also have painful intercourse. I brought along this model to further describe both the surgery and the problem of uterine prolapse. What we have here is the bladder, here is the vagina, here is the uterus, and here is the sacral bone. During uterine prolapse, what happens is the uterus comes from this position and goes down towards the opening of the vagina. During surgery, my job is, after the gynecologist removes the uterus, I attach a small piece of mesh to the top of the vagina from here to the sacral bone to keep it in its correct anatomical position.
Typically, pelvic prolapse worsens over time and can only be fully corrected with surgery. The procedure is called sacrocolpopexy. It is considered the most effective way to correct pelvic prolapse and resolve symptoms. Dr. Glass was the first in Denver and Colorado to perform robot-assisted sacrocolpopexy, directly following robot-assisted hysterectomy performed by an OB/GYN.
Previously, sacrocolpopexy was done with an open procedure using a lower midline incision. Now, with the advances of laparoscopy and specifically robotic surgery, I'm able to do the surgery with 5 small holes in the abdomen. This greatly reduces scarring, reduces pain, reduces hospital stay, and improves their recovery time. Additionally, I am placing this mesh transabdominally, which also reduces the risks you've heard about, mesh erosion.
The Colorado Center for Robotic Surgery at Sky Ridge strives to provide patients with the highest caliber of innovative, state-of-the-art medical care in a compassionate, healing environment.